Hey guys, my name's Andrew and welcome to my channel. Uh, on today's episode, we're going to be talking about mental health again. I did a previous video. We went into mental health in our schools and our workplaces. We're going to be talking about, in general, society. And we're going to also get into a little bit of the activism with mental health, as well as talking about some self-care. So today I'm joined by my friend Yale. How are you
Hello.
doing, Yale?
Good.
For someone like myself who has with mental health issues, I was diagnosed with an anxiety disorder when I was 20, coming out of high school. One thing that I have noticed and has been very, very rampant in society, and maybe things have gotten a lot better now. We'll definitely discuss that. The one thing is discrimination or stigma of mental health, and something that definitely plagues a lot of people. In the last video, talking with my other guest, that there's a lot of that goes on in school and in the workplace. He thought that to a certain extent that it was getting better, but there's still a lot of cases of people experiencing stigma. And I just wanted to, for the listeners, I wanted to include some stats on mental health. I mean, we're Canadian, so I'll add some Canadian stats, and I wanted to start off by saying about 44% of Canadians have reported that they felt overstressed. About 10% has reported having anxiety issues, and about 5% have reported feeling depressed or have experienced depression in their life. And of course, that is just those people that have participated in the survey. I'm sure that, I mean, this is an assumption on my part that there's a lot more people that have dealt with those type of issues. Another thing as well, statistic here from the Center of Addiction and Mental Health based in Toronto, is that just 50% of Canadians would tell their friends or coworkers that they have a family member with mental illness. And that is compared to other people of a family with a physical illness, such as cancer or diabetes. And the number of people that would tell others about a physical illness that a family member have is at about 72%.
Andrew, I think this is something that, like, for example, in the West, like, these things have taken a while to gain any kind of acceptance by society. Like, I know about 40 to 50 years ago, it was actually quite embarrassing for people to admit. In Western society, you see fundraising campaigns, you see a lot of like the community gathering together around the person, you see a lot of support. So this is something I'm hoping will change in coming years with mental health as well. But it's something that's taken society quite a bit longer to grow used to and to get used to the idea that this might be something normal and it's not the person's fault.
It's interesting you should bring that up, actually. In the past, people were more embarrassed to talk about physical illnesses,
Mm-hmm.
and now it's sort of, it's not only is it okay now, but a lot more people are likely to be use empathy when
Right.
somebody is hears about a physical illness like cancer or any type of physical illness, really. And I think maybe partly because of the stigma, but also that a mental illness can be very complicated. It's perhaps having a mental health issue is a little more complicated than somebody having cancer per se.
Right.
For example, having an anxiety disorder can lead to maybe being socially awkward or overreacting to something or underreacting. I think more along the lines of the stigma is that because this person has a mental health issue, that they're perceived or assumed to be mentally unstable. So maybe because of that, they don't want that negative connotation, or they feel less comfortable being around those people. So I find it very interesting from that statistic that you brought up. Like in the original statistics that I had mentioned earlier, about 44% of Canadians, according to the survey, have reported feeling overstressed at some point in their life. Okay, so we have essentially, and okay, so the number of people that have participated in the survey is about 2,000 Canadians. I probably should have mentioned that earlier.
Okay.
And about half of the population of that survey is willing to admit that, that they feel overstressed at times, which I think is very interesting. I think it's safe to say that I don't think that, even though that this is covering only 2,000 Canadians, is that admitting to feeling overstressed, 10% is admitting to having anxiety issues, 5% depression. I would think that those numbers would be a lot higher, considering the fact that, people may not necessarily feel comfortable about revealing that they have a mental health issue because of feeling discrimination. And I know that I have felt the same way. At work and at school, it's depending on the people that I'm around. If I feel like that me bringing that up is going to be received in a positive light, that I don't mind doing that. But, most of my work life, I haven't felt comfortable bringing that up because I would fear of there be negative consequences to that. Well, essentially, it would be being socially excluded in some way. So I was just wondering where your thoughts about that is on people feeling that they're not comfortable bringing that up. And I had discussed with my last guest that was on, I had discussed with him about, we were talking about the workplace, and if you were having a mental illness, if you would feel comfortable approaching your manager or your supervisor, if you're feeling like that. And we had come to the conclusion that probably the majority would not feel comfortable doing that. And that's an assumption on our part, but that's what we came to. I was just wondering what your perspective on that, and in general, would you say that in the modern time now that people would feel comfortable with telling somebody else, whether a friend, family member, workplace, perhaps those two areas are different, about themselves having a mental illness or a mental health issue?
Well, I think you have a point about the statistics probably being a bit higher than is reported, because I do remember when I was in high school, there was a classroom-wide survey about how many people felt that they were kind of like over 50, over 100 stressed, and literally half the room put their hands up. So it seems to be quite common even at that stage, like in high school, and when people get older, I suspect that the amount of stress doesn't necessarily decrease in most environments. Another thing is because a lot of environments like school and the workplace, sometimes there's this odd mentality where there's kind of like a competition to hide your stress or to be the most productive that you can be without showing other people that you're stressed. And sometimes in these environments, there's kind of like some kind of aversion toward weakness. So in that kind of environment, I think it can be toxic for a lot of people, and it might be very difficult to admit that you're going through some mental health issues or you're suffering from a lot of stress, especially if it makes it sound like that you're not going to do the work as productively. However, I have had some positive experiences in the past with work managers bringing up various issues, and they have been quite accommodating. So it really depends on the person that you work with.
Mm-hmm. Yeah, and I really liked your point about people feeling when they're in a competitive environment. And I'm gonna just say for school as an example, feeling that they have to get certain marks to progress or to get on the honor system and that type of thing, and essentially, or even competing to get into a program with other students, and feeling that competitiveness, and I guess you could say hiding that stress that you're having or the anxiety, because it would be seen as a form of weakness. Mm-hmm. And not only that, but if, let's say that you have some family members or somebody else in your life that's relying on you to get certain marks to get into this program, and you feel that you can't let them down, that you don't want to disappoint them, you don't want them to be upset or disappointed in you because you didn't get into the program, and so you have a lot of that weighing on you, and I think that a lot of people will ignore that type of stress, ignore that type of anxiety in order to fulfill everybody's needs, not only themselves, but to fulfill everybody else's. When you're in that competitive environment in a classroom, I think that having that competitiveness, although I'm not necessarily against being competitive, I think that unnecessary competitiveness, for example, we all go to school to learn and to improve ourselves, to discover who we are. You're there for that point. And when you start bringing in, well, not only are you there to learn, but you're also there to compete with Joe over there too, right? Because everybody is competing to get their degree and then get out into the economy as quick as possible. And the only point I'll bring up is that I do feel that in the post-secondary system that some programs are created for that effect, to get them through the program as quick as possible in order to satisfy the economy. And that does create a lot of stresses for the students. But yeah, no, that was that point I think is really important.
I think I wanted to mention a couple things. So within like a lot of school programs, like professional programs, like even say social work and medical professions, quite often there's a lot of competition just to be able to be qualified to enter the field. And of course, like in a lot of these programs, there's like in a lot of these professions, there's a lot of stress on the job, and so if students are not being acknowledged when they're coping with stress in the classroom, perhaps that doesn't set them up very well for those real life situations. And although I do see some of this changing, like I do see some types of mental health training and awareness being introduced in some of these classrooms. Another thing I wanted to bring up was the fact that for a lot of students, when they're going into the university or a college environment, they often find that more and more their stress is not very much being acknowledged. It's like, does this prepare them for, like, a lot of them will be questioning, like, is this what real life is going to be like? Like, do I really have, a place in this society or a place among my peers? So that can create a lot of, I think, unnecessary stress, because a lot of students don't feel the right to speak up to people. And quite often in education, there's this very hyper-competitive, not just hyper-competitive, but very hyper-individualistic environment. Because in some countries, it's actually quite normal for students to help each other all the time. Like, even in Canada, this varies between different post-secondary campuses. But I'll give an example. Like in China, from the time that students are in elementary to middle to high school to university, it's quite common for people to essentially like collaborate and help each other on everything. And it's actually the opposite of here, because here in the grade school system, people are often like, it's not as rigorous. And then in university, that's when it starts to become very, very difficult, and then people start to buckle down. Whereas in China, it's actually the polar opposite. Whereas the grade school system is extremely difficult. They prepare you for a series of very difficult tests that are very hard to pass. And then when you get to university, it's basically supposed to be easy. Like you pay and you get in, you get your degree. So I think between these different cultures and environments, especially if people are transitioning between different places, I think it's very easy to feel isolated and lost.
And that's a good point that you brought up about the the differentiating cultures there. With like you're saying that it's a lot harder in the grade school in China, and then it's sort of a lot easier when you're in post-secondary education, and it's the opposite here. According to this is from the same study that was done from the Center of Addiction and Mental Health in Toronto. In the study, it states that about 49% of Canadians would socialize with somebody with, it says, a serious mental illness. The other side of that, we had talked about people feeling comfortable or not with feeling that they have a mental illness, or telling somebody that they have a friend or a family member with a mental illness. Now, on this particular stat, stating that roughly about 50% of Canadians in the survey would not even socialize with somebody with a serious mental illness. It comes back to where the state of awareness is for mental health, and the level of stigma with mental health. I think personally on my end, I think it still is a large issue. And although there's been improvements with different campaigns with mental health, different organizations that exist that spread awareness, I guess pushing that empathy for people, because I think not only is the stigma which comes from potentially somebody being mentally unstable and not wanting to deal with that, there is also, and unfortunately with mental illness, it can create a lot of anger with who has a mental illness, and perhaps people that are abusive can be mentally ill. And I think that, in my opinion anyway, that a lot of people that are abusive are mentally ill. The one thing is that not all people that have a mental illness are abusive. And I think that the stigma itself will basically just wraps everything up in a bow and sort of paints everybody in the same category. There are some new campaigns out there in the last several years that have really pushed mental health awareness. I know that when I was going to university, they had the organization, the COPE organization, as well as MSS that existed, and those organizations at the university, provided a space for people to participate, for people to be involved into, I think, particular for MSS was, yes, peer counseling. I believe was part of the initiative of that type of organization. I guess everybody coming together and feeling supported by other people that was dealing with mental health issues. I think COPE in particular was an organization that spread awareness around the university, dealing with mental health stats and discrimination, and that those particular organizations were localized within the school system. Although MSS and COPE, I believe, allowed other people to come in from outside of the university to be involved in some capacity. Of course, in going outside of that particular school, we have other campaigns going on in society. For example, the Bell Talk campaign, which Bell in the last several years, I would say, have really pushed that. A lot of it on social media. We see commercials about it on TV, pushing people to recognize mental health issues. Now, the thing about that particular campaign, and I think first of all that it's great that they're doing something like that they're taking that initiative and putting that out there to bring awareness for mental health issues. Bell hasn't had a particularly good track record with their employees, at least from what we've heard in the news and stories, that employees have come out and said that there's a lot of mistreatment that goes on. And I know that for me in particular, and I don't want to paint everybody the same brush, but there were some people that were fairly hostile with me in customer service. But with that being said, those people may be being mistreated from their superior or by their coworker. Even though that it's wrong to be disrespecting people, even if you're the one being abused, the abuser themselves, and I'm not necessarily label them abusers, but somebody who, let's just say they'll bully, like some bullies are themselves victims as well, right? So you can have generational bullying where you have parents or you have somebody in their life that bully them, and then they take it out on somebody else, and then that person takes it out on somebody else, and it goes on like a chain, right? And you could have the same effect going on at Bell. But I do find it interesting that they're putting that out there, but meanwhile, some employees are come out about this type of thing, that that their employees are being mistreated. So it's that I think is a very interesting scenario because of that type of organization that is putting positive mental health awareness advertising out there, yet is dealing with their own issues with bullying and that type of thing. I think that that is an example of I think we're in a period of transition right now where we're in the beginnings of having more mental health awareness, perhaps people being more empathetic for people with mental illness. But we're still in that raw area, I think, that transition area where we also still have a lot of work to do, right, in society. And there's so many factors involved in that. From your perspective, in terms of organizations and mental health awareness in general in our society, do you feel that there is more of that happening right now? Do you think, and also, do you think that they're effective at what they're doing? What do you think about what I said about the transition period? Do you think that that's happening right now? Do you think we're in a transition? Do you think that it's below that we actually have a lot more work to do? What's your opinion on that? What is your opinion on the campaign so far from people and organizations to bring awareness of mental health?
Well, I would say that we're kind of at the beginning of a kind of transition period, only because society hasn't quite reached the level of engagement and support of people with mental health as it has with physical illnesses like cancer. I think it's been helpful at some level because if it creates an awareness that for some people, like their peers or even themselves might be going through something like that, if it allows people to speak up about their situation in a way that's actually helpful for them, then I think it's achieving some of its goals. However, I do think society is still quite a bit behind when it comes to mental health, especially compared to a lot of the other things that society has grown an acceptance of. And still today, sometimes individuals are blamed when they develop mental health problems and or when they have struggles dealing with the amount of workload that they're getting. And I think really important here is that this doesn't create some kind of us versus them kind of mentality, which is like, it would be easy for people to kind of like associate this with some kind of other movement that they don't approve of. So I think those are some of the hazards here, but I do think that I do think in essence that a lot of the drive for awareness for mental health is changing the way that people talk about not just mental health, but how people live in society in general. And I think that these are some important conversations we need to have. However, I think there's still a long way to go.
Yeah, no, I agree. I think that there is a lot more work to go. And I do think that the campaigning now and the push for mental health awareness, I think that it is working to a certain extent. Maybe because I'm in the child services field, I sort of see more of that because in that particular field, it's a lot more open to that sort of thing, right? The field in general is designed to be empathetic to those with mental health issues. I think that particular field is, I guess you could say, a little more advanced than the general opinion, I think, in society. I think that we all have seen it where, we either know somebody approaching somebody who, like, let's say that you're walking down the street and you see somebody crying and they're upset and they're either sitting on the sidewalk or they're on a bench. I think a lot of people would step in, but I think a lot of people would also not be comfortable with that. It actually, it reminds me of this picture that I had posted on Facebook a long time ago, and it really made you think. Basically, a child had filled it out, and the child had basically said she wrote out that, well, how come whenever somebody asks you how you're doing, you always have to say I'm fine, right?
Right.
Because in reality, whenever someone asks you how you're doing, 100% of the time you're not always fine, right?
Right.
So the thing is that if somebody, if somebody's approached and they say, just in greetings and saying, "Hey, how's it going?" and you're like, "Oh, I'm not doing so well," and then it turns into, does that person want to make the effort to
Right.
um, essentially, in their mind, become your counselor? And I'm not, and the reason why I put it like that is because even though that, like for me, for example, most of the time, if somebody says to me, "I'm feeling well," I will talk to them about it, because I know that a lot of the time it usually gets brushed off, or
Mm.
people don't want to get into it unless you're like very close. You're with close friends, and I'm more or less talking about like if you're with a colleague or something. Uh, so, I think there's a lot of people that don't feel comfortable with doing that. They might say, "Oh, I'm sorry to hear about that. Hope you're feeling better," and sort of the conversation ends,
Mm.
right?
Right.
And going back to the person that's crying on the bench or sitting on the sidewalk, how many people would feel comfortable with approaching that person and asking them if they're okay? As a society, what, the level of empathy that we have is really tested by when we meet up with strangers in some capacity, and from a character perspective of approaching somebody who is crying or needs help or in some kind of crisis. Let's say that you're going mountain climbing and somebody slips and they're hanging off the side there,
Mm.
and you're, immediately, you probably agree with me that probably about 9 out of 10 people would help their partner from
Right.
that, right? I think it would be a lot different if, uh, and let's not even say their partner, but like let's say that this is a colleague that
Right.
let's say they're in a club or something and they go for hikes, right? And you don't really know this person too well. Versus if you see a colleague or a stranger crying on the street, of approaching
Mm.
them to provide some type of empathy.
Right.
Um, would you agree with me that people would more likely help the person who's in physical danger rather than has a mental crisis or having a mental health issue?
Right, because I think with some of these physical activities, there's more of like a kind of like camaraderie, like kind of feeling that they're all in this together, and if somebody gets into trouble, well, like somebody else has been through this before. But with a lot of like um, situations where you see a stranger, or even if you see somebody who you don't know that well, in another type of crisis, sometimes there seems to be like less of a feeling that the person wants to be responsible or wants to get involved. It's less likely that the person will, like in my opinion, it's less likely that they'll want to show that they care for the other person. And that could be a lot of different reasons. Like it could be the person doesn't feel like they are experienced enough, or they feel like they might lead the other person in the wrong direction.
Yeah, no, I agree with you. I think there is a certain pressure on somebody, to a certain extent, and I think that you have that with the physical scenario as well. But
Hmm.
um, there is a pressure there that, like you said, will you lead this person in the right direction?
Hmm.
Will If this person, for whatever reason, is not thinking clearly, will you now be a target? Mental health issues are very complicated, and it's different from just somebody having cancer versus mental health, because there's all kinds of areas that are involved in mental health. Like, I don't want to sound like a hypocrite. There are times that I don't approach people that are on the street. There are times that I have done that, and I've asked them about their situation. I think that that pressure does weigh in a lot in whether people want to get involved or not. Um,
Mm.
and I think that because of that, and also because of stigma, is that I think a lot of people would rather not get involved because of the effort that they have to make. Um, with dealing with that person. I think it really asks an important question in our society of empathy. We're born to take care of others and to care about people and to love each other. That is what we are. And I think that a lot of the problem is that people don't necessarily have the social skills to do it, to intervene with people that are having hardship, along with the values that they're taught, right? So if their parents don't necessarily would approach somebody like that, then it's probably likely that their children isn't going to do something like that. Stigma with mental health is ingrained in the way we think, just like you were saying before, because I really liked your example about people being embarrassed to admit physical illnesses. And it's so ingrained in our society and who we are it's learned behavior, right? We're born to care about people, we're born to love people, but this learned behavior is incorporated into that in terms of selective empathy. For example, not just to touch on it briefly, that racism, for example, is a learned behavior, right? You're not born to hate people, right? You're not born to exclude people. That is something that you're taught from others, right? That is a learned behavior. And I think that the same is true for mental health.
Yeah, I think that if they did more kind of like, I don't want to make a recommendation, but if they did more kind of like role play scenarios in like schools where they have this kind of situation or something like that, because that kind of thing is learned at an early age. It probably, like, for a lot of cases, it probably would be better if it was unlearned at an early age as well. So I think when people are kind of like in their 20s and 30s, and then you're trying to train them to, to be more empathetic to others, like sometimes only a select group of people will be comfortable approaching this kind of scenario, and then all the pressure is put on them. So I think that it's if we're as a society to tackle this more effectively, I think it's more important that youth and children are educated on this as well.
Exactly. So lastly, I wanted to bring up, the discussion on mental health it's very complicated. It's definitely ongoing. And there's so many aspects in mental health. And I think that one important thing that maybe doesn't always get touched on that is very important is self-care. Not only for yourself, but for others. And for me in particular, I'll just name off a couple things that have really helped me out. First of all, I get stressed fairly easily, and my stress levels build up quite a bit. I don't know if it has anything to do with my anxiety disorder or particular stress disorder. I do get stressed quite easily. That affects me. And I usually go to the gym about maybe 4 times a week. And that helps me a lot with reducing my stress levels. It's a positive coping mechanism that I use for myself. And, stress, which I think is the root of a lot of mental health issues. I go to the gym because it eliminates my stress. It's the best thing for me to do that. Of course, I try to eat healthy, and it's all a combination of that. But that's one thing that I like to do to manage my stress levels. In terms of anxiety, there's certain refocusing techniques that I would do in terms of trying to quiet my mind and to bring myself back to into a more focused position. And it sounds easier when I say it. It's definitely a lot harder when it's in practice. But that's one thing that I have done in the past. And one thing, and this is a good point, is one thing that helped me out a lot was going to workshops, mental health workshops, for social anxiety, for depression, psychology. One particular workshop that I attended, they had asked you to basically a few times a week to write down 3 accomplishments that you've made in your life and 3 good qualities that you think you have. And I will tell you that doing this, it may sound a bit cheesy, but doing this really had an impact on me. And when you are in a negative mind and you only see the world through a negative filter, and the whole point of this was to recondition my mind to shift to a more positive mindset, because at the time I basically had seen the whole world through, that I just saw the negative, right? And after doing this for several weeks, not only was it motivating to be reminded of, well, hey, I accomplished this, and maybe I am really good at this. It really gives you a new motivation to look at the positive side of things. And it was one of the several things that I had done at the time to really get me into that positive mindset. And I just wanted to put that out there.
I think one point that I will make about self-care is this. One thing that I've noticed recently is that when I get overly task-oriented, I tend to try to squeeze too many things into my day. And when that happens, I tend to be very rushed. I also tend to be less empathetic toward others. So I find that something that's helpful for me in terms of self-care is if my day is becoming too overwhelming, if I'm trying to force myself to do like 10 things in a day, I might not do all 10. I might just do a few of them at a time and then see what happens afterwards. So that way I can be more spontaneous. I can even be more caring toward others. And I actually read this tidbit recently. And I know that some people will agree with me, some people will disagree. But I found it really useful because you keep hearing that people say that if something's worth doing, then it's worth doing well. But I heard somebody share this meme, and it's kind of like this. A college professor said, if something is worth doing, it's worth doing poorly. So it's kind of like this. If you're too overwhelmed to brush your teeth for 2 minutes, then brushing it for 30 seconds is better than not brushing at all. If you've been cramped up inside for 3 days and you don't want to do a 10 or 20-minute walk, then standing outside on the porch for 30 seconds is better than nothing at all. So I think, these kinds of things are helpful in terms of self-care.
You know what? I really like that. Just doing a little bit of something is better than not doing. Like you mentioned about having too much to do and too many tasks to do.
Yeah.
And with the whole multitasking aspect of it, I have done a video of it. I had read into that multitasking isn't necessarily natural. And I think that creates a lot of anxiety and stress. And I think you would probably agree with me that when you are doing several things at the same time, because you're not focused on one particular thing, that your attention is divided among all those items.
Right. And if somebody asks you for your attention, and then you might end up feeling like you're too important to give attention to somebody else.
Right. Because you're also adding another thing onto your plate. Right now you have all this stuff you're doing, plus now this person is here and you have to deal with them. Naturally, when you have a lot of things going on, your attention, you may not do the work that you're doing may not be as good because your attention is being divided. That's an important thing to talk about for mental health in the workplace and in school. Just lastly, I would bring up that I think that maybe doesn't really get talked about too much, and that is the stigma of asking for help, the stigma for seeing a counselor, because I think that a lot of people aren't comfortable with that because they may think, well, I'll be labeled as crazy or I'm going to be discriminated against because of that. And I'm going to admit it that, I've been seeing counselors my entire life. Since I was a child, I've been seeing counselors. And I will say that even though that there are some that are excellent and there's some that you really have to be comfortable with, they really do provide a great service. And especially when you don't have a lot of social contacts and people that you can rely on in terms of supported, like a support network. Even though that, and some people say, well, they're getting paid to do it, and it's not really, it's not real because of that. Well, yes, they are getting paid, but they wouldn't be doing the job if they didn't enjoy doing it, right? They are there to listen. Sometimes having somebody listen to what you have to say is one of the most therapeutic things that you can have. Seeing a counselor is not a bad thing. It can be very helpful to people. It's been very helpful to me. I think that the therapeutic value of being listened to is not recognized enough. And I just wanted to put that out there that that's also a great resource as well. So we've come to the end of our discussion, and I want to thank everybody for listening to us. And please, if you're comfortable with it, post in the comments below. Let us know about your stories, about your perspectives and opinions on everything that we've talked about, because we would love to hear from you, because this is such an important topic. And like we said, there's a lot of work to be done, but there's still some work that's happening right now that's pushing the movement forward. I want to thank my friend Yale for joining me today. I really appreciate it. I really enjoyed the discussion.
You're welcome.
Thanks again, and make sure that you give this video a like. Make sure that you share, and if you haven't already done so, make sure you subscribe. You keep it locked on the Andrew K channel.